This presentation will take you on a journey through New Zealand's healthcare system, how it's tackling inequalities, driving innovation, and setting an example for the world. Let's dive in. Let's explore the key factors shaping healthcare in New Zealand using the DEPLESET framework. New Zealand's healthcare system faces significant challenges, including an aging population, rising non-communicable diseases, and persistent health inequalities, particularly among Maori and Pacific communities. Major reforms like Health New Zealand and Maori Health Authority aim to address these disparities, while new legal and technological advancements enhance care quality and accessibility. However, economic pressures, climate change, and growing costs strain the taxpayer fund system, demanding sustainable solutions. Despite these hurdles, investment in AI, digital health, and equitable policies presents promising opportunities to reshape and strengthen healthcare for the future.
Over here, we can see from the positioning map the key factors affecting New Zealand's health system, their impact, and timeframes. Demographic and aging population projected at 23% over 65 years by 2030, coupled with diverse healthcare needs, creates a high and long-term impact on resources. Economy slow GDP growth of 2.2% in 2024 and rising costs strained funding. Impact ranges from low in the short term to high long term due to sustainability challenges. Politics, reforms like Health New Zealand and the Maori Health Authority addresses inequities with high impact, medium to long term, supported by the Treaty of Waitangi. Legal laws enhancing equity and safety-driven medical health have a high medium to long-term impact on system efficiency. Ecology, severe weather impacts healthcare resilience. The National Adaptation Plan brings medium to high impact short-term, rising long-term. And social, health inequities, especially for Maori and Pacific communities, drive medium to high short-term impact, rising long-term as reforms progress. Epidemiology, chronic diseases and obesity affecting 39% of adults pose medium to high short-term impact, escalating in long-term. Technology, AI-driven healthcare improves accessibility but requires regular updates with medium to short-term and high long-term impact.
Are ensuring equitable access to healthcare for everyone, regardless of geographic or socioeconomic disparities, by expanding primary care option, increasing telemedicine services, and enhancing access to cancer screening and pharmaceuticals. Efforts are also being made to close gaps in healthcare access for Maori and Pacific communities, but this population live in the most socioeconomically deprived areas, which are linked towards health outcomes and limited access to primary care services. Another goal is reducing waiting times for healthcare services, and here you can see the targets. But emergency departments often face overcrowding, there's workforce shortages, and technological gaps. New Zealand is also addressing healthcare worker shortages by expanding training, recruitment, retention, and development of a culturally competent and responsive workforce. But there are heavy reliance on overseas recruitment, and while this approach addresses immediate gaps, it also highlights the lack of sustainable domestic workforce pipeline. The country also wants to build resilient healthcare systems supported by strong digital and physical infrastructure to meet current and future needs. And while efforts have been made to consolidate these systems under platforms like the HERA project, technical debts and funding constraints have slowed these efforts. Obviously, it also wants to provide quality for patient care and management processes, but recent health reforms that aim to unify healthcare under Health New Zealand, replacing district health boards, has also introduced uncertainty and operational challenges. Here you can see the health level and distribution data of Canada and New Zealand. We can highlight the difference in public health spending, with Canada allocating more per person to healthcare compared to New Zealand. The data highlights how both countries prioritize health spending, but with some variation in overall public funding levels per capita. Moreover, New Zealand data are from 2022, but the percentage of health expenditure in gross domestic product marks a post-COVID increase, as prior years saw the percentage fluctuating between 5.3% and 5.6%. Has been a market for primary community and public health services to enhance access to preventative and routine healthcare, while more than $3 billion has been allocated to hospital and specialty services to improve emergency and inpatient care, as well as specialist consultations. New Zealand has progressive taxation and subsidies for primary care visits and prescription that aim to reduce costs for vulnerable populations. For example, community services cards provide discounted GP fees for low-income households. Moreover, the Paiora Act of 2022 demands equity for the Maori population. Approximately 83% of adults reported being able to access primary healthcare when needed, but the time to get a GP appointment was too long, and despite this remains for the Maoris. Moreover, patient may select their preferred GP, keeping in mind that most operate as private business and may charge fees. On the other hand, patient cannot typically choose their specialist or hospital when using the public health system, and since publicly funded specialist care often involves long waiting times, particularly for non-urgent procedures, to avoid delays, some patients opt for private care where treatment is faster, but it also requires out-of-pocket payments.
Let's continue to the starship and organization of New Zealand health system. It underwent significant reforms in 2022, shifting towards centralization. As the structure diagram shows, you will notice how it reflects a model of vertical integration and horizontal segmentation. Vertical integration is evident in the formation of Health New Zealand. It merged 20 DHB, centralizing funding and delivery. However, localities maintain some flexibility and more detail shown in the post-reform entity and responsibility figure. On the horizontal side, the introduction of the Maori Health Authority addresses health disparities specific to Maori populations. This segmentation ensures their needs are targeted, while the authority remains part of the broader health system. The Ministry of Health is the system's primary stalwart in the tube system centralized operation to reduce fragmentation, improve efficiency, and promote equity and diversity. However, centralization also has some challenges. Overlapping roles within the framework can lead to coordination and accountability issues. There's also the risk of bureaucracy, which may slow responses to urgent problems. Furthermore, funding mechanisms for reducing inequities remains underdeveloped.
New Zealand's health system, funded primarily through national taxes, such as personal income tax and goods and services tax. Additionally, individuals pay part of the cost, that is, out-of-pocket costs. Also, private insurance serves as an important complement. After the reform in 2022, the T2R New Zealand Health Service unified management and allocation of resources, still using a cap-based allocation model to ensure the fairness of health resources across regions. However, although the centralized management of tax funds has reduced the system operating costs, long waiting times and uneven distribution of medical resources in regions, especially in remote areas, continue to be significant obstacles to system efficiency and service accessibility.
Moving on to resource allocation, New Zealand employed the population-based funding formula to distribute resources. In Budget 2024, there is a strong focus on addressing inequality, with funding allocated across key areas such as hospital service, primary and public health and medicines. Some targeted initiatives like expanding cancer screening programs, free mental health counseling, and creating a national mental health innovation fund. These efforts aim to improve access and outcomes, particularly for underserved populations.
Then let's talk about the provider payment system. Funding allocation and doctor salaries for public hospitals are mainly carried out through a fixed budget model, and some specific services, such as elective surgery, are still supported by special funds. Some hospital services may continue to use the case portfolio payment (DRG's) model. Primary care, such as GP, applies capitation payment, while fee-for-service is used for services such as vaccination. Despite reforms aimed at reducing disparities in resource allocation between urban and rural areas, mechanisms to incentivize chronic disease management and long-term care remain limited.
New Zealand's health system is centrally managed by the Health New Zealand Authority, which administers hospital, primary and community healthcare, and the Maori Health Authority, which ensures that Maori health needs are met. Services are provided at 3 levels: national, regional, and local, to meet the specific needs of the community. The main types of the healthcare provided are primary and specialist care. Primary care is led by primary care organizations and emphasizes community-based services, such as general practice and mental health support, reducing reliance on hospitals. Public hospitals are responsible for emergency and specialist care, while private providers offer non-emergency services supported by private insurance. Healthcare is mainly funded by taxes, so most services are shared by the entire population. However, gaps remain in adult dental care and non-emergency surgery, often requiring private insurance or out-of-pocket payments, which affect low-income, Maori, and Pacific population. Rural areas face additional barriers that can be addressed through telemedicine and localized networks. While patient satisfaction and avoidable mortality have improved, equity challenges remain. To improve equity, New Zealand needs to expand resource allocation and telemedicine to better meet the needs of Maori Pacific people and rural areas. Workforce investment in AI via training and diversity strengthens healthcare delivery. Prevention, including education, green infrastructure, and cross-sectoral policies, ensures sustainability and reduces future healthcare burdens.
To summarize, New Zealand's healthcare system is universal and tax-one. Reforms in 2022 established the Maori Health Authority and Health New Zealand, focusing on equity for Maori and Pacific communities. But challenges remain: an aging population, chronic diseases, health disparities, and climate impacts, strained resources. Despite high spending, financial sustainability is critical. New Zealand is transforming healthcare, proving equity and innovation can pave the way for a better future.